Being a rural health system used to mean apologizing for it. You couldn't do the things you wanted to do. You didn't have the specialists. Not anymore. Today, rural health systems are tackling medicine's hardest problems with technology and innovation. CASI, the Center for Aging with Serious Illness, is a new research program being launched at Dartmouth Health with an $11.8 million grant from the NIH. Its goal is to build the next generation of scientists dedicated to caring for older adults with serious illness. At Dartmouth Health, we're surrounded by two of the oldest states in the country, New Hampshire and Vermont. And we are rural, which means the hardest questions in medicine are at the core of what we do each and every day. CASI will grow scientists by taking our most promising young physician researchers and training them with the tools to spend the rest of their careers answering the hardest questions right here in rural America. Because we've stopped thinking of rural as the problem. We think it's the new frontier. Not in Boston, not in New York, not in San Francisco. The most innovative work in medicine is happening right here at Dartmouth Health and the Geisel School of Medicine at Dartmouth, in the middle of the woods, in the heart of New Hampshire and Vermont.
One of the things that we're so excited about for the COBRE is its focus on rural health. So in general, the challenges of doing research in rural populations include things like distance and connectivity to the internet and things like the weather. But what we also find is there's a different culture when we're doing research in older adults living in rural America. For example, there's the concept of rugged individualism, which is a desire to not necessarily always interact with the healthcare system or to give data or be a research subject. The culture of, I can do this myself and I don't need help. And so the question and the things we're excited about in terms of the COBRE is, how do we improve care for older adults in serious illness, both in terms of getting them to be part of our research studies, as well as making sure that their special needs and the culture of living in rural America is a core part of the work that we do. One of the challenges that we think about in doing research in older adults or those with serious illness relates to how difficult it may be for them to participate in surveys or complete all of them in one sitting, or perhaps they're missing a survey because they have to go to a doctor's appointment or because they're in the hospital. And how do we think about things like consenting for them and consenting adults who may have cognitive impairment and may not completely understand some of the questions we're asking or the complex concepts behind them? And one of the things that our COBRE grant will do will be to create a special core, a special research core that will help scientists, particularly early career investigators, begin to grapple with some of these challenges in conducting research in older adults and those with serious illness. For example, if you have a 30-year-old, they might have no problem coming to the hospital to complete your surveys and understanding it. But if you're dealing with an 80-year-old who might have cognitive impairment and several chronic medical conditions, they need special research dispensations and considerations that younger populations may not have. And we know that when we teach investigators how to do research, we don't always teach them how to think about these special populations. And that's one of the really exciting things about Bedrock is we'll have a special core that looks specifically at ways to include these individuals fairly, safely, ethically, and with the highest level of scientific rigor, so the data we get is of the highest quality to improve their care and the care of their loved ones. This grant is a special grant that will provide us the infrastructure and the skills to train a whole new cohort of early career investigators and research scientists to improve the quality of care we provide to older adults and those with serious illness, not just here in New Hampshire and Vermont and Maine, but across the United States and beyond.